Urged to heed the clarion call to end the TB epidemic. We now cross live to our colleague Tumelo Machogo in Mbombela for more on how the day is being observed there. Tumelo, a very good morning to you. What can you tell us?
Good morning. Good morning, Desiree. The Minister of Health, Zweli Mkhize, just arrived here at Mbombela, where they're expected actually to launch that to commemorate World Tuberculosis Day. He's here, and also he's been currently now doing the COVID-19 registration to check if he doesn't have any COVID-19 or anything. So he also doing that. We're expecting the Deputy President also to be here, and also the Premier of the province, Ms. Refilo Msweni, also to be here for this day. We'll try and speak to the Minister quickly, but before we can go inside, before he can go inside on this day, we remember that this day is a day to commemorate TB Day. They're also trying to raise awareness, especially to the public out there, to tell them about the TB, actually to also go to communities to inform them about this day, and this day is actually very important to raise awareness about TB, because we know that a number of people in South Africa live with TB, and also the fact that TB also has been one of the silent killer actually here in South Africa. Many young people and many people have been killed by this TB, but also we are expecting the treatment action campaign also to protest outside, but they have not started as yet. We know that they've been calling for government to actually declare TB as a national emergency, so we'll try and just steal the minister, because he's now finished with he's currently greeting the nurses there. He's just finished with his COVID-19 testing. We'll try and just doorstep him and try and ask him a few questions. Minister, thank you so much for joining us. Talk to us about this day. What does this day mean to South Africa, and especially to people living with TB?
Well, it's an important day to remind ourselves about the work that we have to do to deal with the fight against TB. It's a very important fight. We still have many people who still die of tuberculosis. Almost 40,000 people die every year. And we've seen that in this past year, the treatment, the follow-ups, the testing on TB has actually been affected, and it went down. So I think it's important for us to revive the focus on TB, still a major killer. So that's the importance of the day today.
And also are you saying that the number has gone down, treatment action campaign, they're saying that also the funding has also gone down, meaning that a lot of people have not been tested, a lot of people have not been going to hospitals, especially now with COVID-19. What are we going to do to make sure that we mitigate that?
We will be talking to the TAC, but I think it's an important point that we all acknowledge that COVID-19 situation disrupted the treatment for TB. We're trying to put it all together. So we've got a catch-up plan to try and increase the numbers of people who are coming every month for treatment, those who get to be followed up for treatment, and those who complete the treatment. So we have to reactivate all those programs.
Okay, Dad, just one question. When it comes to COVID-19 and the rollout of the vaccine, how are we doing as the country? Are we getting there, especially to vaccinate healthcare workers in the country?
The vaccination is going well, but would have liked to see a better speed than what we've seen now. But there is a delay because the delivery of the vaccine is a bit slower than what we would have liked to see. And we've been engaging almost twice or thrice a week with the various players. We have to tighten up on the agreements and everything. But we still expect that, as we have indicated, more of the vaccines will be coming around April, because most of the companies that are manufacturing will be releasing their vaccines around that time. So we had actually procured the batch which had been used for the trial, for the research, because we wanted to just make sure we start. But the one that we expected from Pfizer is delaying a little bit, so we want to just conclude with them so that we can get as much as possible of the vaccines. But certainly when we come to April, there's going to be a huge scale up of the vaccination program.
Okay, thank you so much. That was Minister of Health, Dr. Zweli Mkhize, actually going in now for the day to start commemorating the TB tuberculosis day here in Mbombela. We're expecting a lot of dignitaries actually to arrive. We know that the World Health Organization is also going to be represented here. We know that they're also going to be talking to us today to make sure that, you know, like, what are they doing to curb the scourge of TB, especially in South Africa. You know, treatment campaign action has been saying that, what the minister has said, actually saying that the number of people being tested has actually gone down by about 9 to 25%, which is a lot for the country where TB actually, where South Africa is being rated as one of the among the 20 countries with the high number of people living with TB. Desiree, I'm going to just hand it over to you because it's quite busy here. People are trying to also to come in for this event because it's expected to start around about 10 o'clock this morning.
I imagine we have sufficient information for the moment, and thank you so much, Tumelo Machogo, for bringing us up to speed.